Hello friends, welcome back to my YouTube channel. We did see a lot of videos on acne, acne scars, pigmentation, but here we talk about one of the most common conditions affecting almost 1 in 5 women who attend our OPD and beyond. PCOS. What do we know about PCOS? Is PCOD about irregular periods? Is it about infertility? Is it about menstrual irregularity? No. There is a lot more to PCOS than what meets the eye. PCOS means Polycystic Ovarian Syndrome. Syndrome means it's like a constellation of signs and symptoms which are pointing towards a metabolic syndrome. Whatever we eat in our body actually gets broken, digested into glucose. As soon as the glucose levels are detected in the blood, body secretes insulin. Now, insulin is like glucose manager. The job of insulin is to promote glucose absorption in various other organs. If there is a more glucose overload, naturally body secretes more insulin in quantity. But as the workload of insulin increases, the quality falls down, insulin levels are more in the body, and these increased insulin levels affect the ovaries and cause anovulation and menstrual irregularity. The same increase in insulin level impacts the growth phase of the hair. In our last video, we had discussed about the causes of hair fall, where we talked about anagen as known as the growth phase. So increased insulin leads to a decrease in the anagen phase, hence leading to hair thinning. The same increase in insulin is also impacting your oil gland and causing inflammation, hereby patients suffer from late onset or adult acne, also popularly known as hormonal acne. So it's not just the hormones, but the insulin resistance or glucose metabolism that plays a very, very important role. And it is imperative for you to understand the impact of a PCOD diet. What is a PCOD diet? It is low carbohydrate, high protein diet which decreases the insulin level in your body, hence improving the treatment outcomes of acne, hair thinning, and menstrual issues as well. Coming back to how does a treatment of a PCOD patient differ from a non-PCOD patient? Let's first discuss acne in PCOS. As I said in my preceding few minutes, that increased insulin causes inflammation in the oil gland, triggering acne. Clinically, the late onset or hormonal acne is more found in the lower jawline. It is more resistant to treatment, it leaves behind deeper scars, and it is naturally much more painful. Treatment-wise, patient does not require a topical retinoid, but we might have to add hormonal therapy to the treatment as well. Low dose ethinyl estradiol and progesterone combinations are used. Spironolactone is a very useful analog in improving the androgen index in a PCOD patient. Nevertheless, a PCOD diet and weight loss will go a long way in improving the outcome of acne treatment. PCOS and hair fall. Now, the same increased insulin level, which is decreasing the growth phase, can be managed with a PCOD diet. The patient needs to exercise and improve the quality of insulin secreted. I would like to particularly emphasize the importance of walking after the 3 big meals of the day. The patient has to take at least a 15 to 20-minute walk after finishing breakfast, lunch, and dinner, because at this point of time, your body is secreting maximal insulin. It is very important that the patient avoids long periods of fasting and we eat at regular short intervals. Patients of PCOD may require minoxidil to improve the anagen phase. Minoxidil might be very important for patients who have suffering from hair thinning, as they help in reversing the miniaturization. The patients might also require some adjunctive therapies like derma roller, mesotherapy, and platelet-rich plasma. PCOS patients also have seborrhea or increased sebum secretion. There would be a remarkable change in the oily secretion of your face and scalp once the patient is able to achieve an ideal weight using exercise and lifestyle changes. It is important for the patient to understand that it is very important to eat right, sleep right, and exercise right when they have this pre-metabolic or pre-diabetes, is what I call PCOD as. So dear friends, if you like this video, please let us know. And if you have any suggestions or questions, please do drop it in the comment section below. Thank you.